Hello everybody, my name is Ryder Trutman. As an athlete who has frequently experienced hamstring issues, the objective of my session today is to teach the Romanian deadlift, otherwise known as the RDL, to post-hamstring tear patients in hopes of strengthening the hamstring to prevent re-injury through the physical therapy concept of eccentric training. Before jumping straight into the Romanian deadlift, I would start skill practice by having my patient or client perform a brief 5-minute warm-up on the seated bike. During this warm-up, the resistance of the bike will be increased accordingly to my client's strength to promote optimal blood flow and muscle activation to the lower body, therefore reducing risk of injury, increasing strength, and priming the body for physical activity. Now that my client is warmed up and ready to go, we will begin the skill practice. Since we are placing an emphasis on injury prevention, I will incorporate practice constraints during the performance of the Romanian deadlift in the form of a minimum 3-second eccentric, restricting the patient from overloading the lift and ensuring that they fully lengthen the hamstring. As for the actual drills we will be performing, we will break the practice up into first a light wall touch RDL to emphasize the hip hinge movement while still maintaining that 3+ second eccentric. After the wall touch RDL, we will move on to a paused RDL, placing another practice constraint on the skill by emphasizing a 3-second long eccentric with a brief pause in the lengthened position to help strengthen the hamstring. While instructing the RDL, I find it easiest to use attention cues, as it is a very complex and physical skill, and attention cues make it easy to draw learners' attention to specific aspects of the movement. By breaking the practice up into these two specific drills, we will be utilizing drill design to first emphasize the hip hinge with the wall touch and eccentric/lengthen movement with the paused RDL. Once skill practice is done, my client or patient would then perform a 2 to 3 minute static stretching cooldown consisting of a hamstring stretch, a glute stretch, and a hip flexor stretch to target the primary muscle groups used in the RDL. Now my good friend Drake will give us a demonstration on the RDL and the two drills we will be repping. Alright, here we see Drake first performing the wall touch RDL. As you can see, his back is arched and he is not firing his hips back all the way to the wall. So we're going to work on this when he completes his second set. But if you look closely, his hips are not touching the wall and his back is not perfectly flat as it should be. Alright, so here I told Drake to keep your back flat and shoulders pulled back, which would be an example of an internal attention cue. And I also told him to push his hips back towards the wall behind you, which would be an external attention cue since he is interacting with his environment. As you can see, the RDL looks way more functional and his form is much better than it was before. You may also notice Drake is placing an emphasis on that 3-second eccentric, which is a perfect example of the constraint we placed on this movement beforehand. Now for the paused RDL. As you can see, Drake is still performing the 3-second eccentric constraint, now with an added 1-second pause at the bottom to emphasize placing the hamstring in a lengthened position. However, Drake is dropping his hips now rather than hinging them back, which is removing his hamstrings from the movement and no longer doing what we need the RDL to do, by making this look more like a traditional deadlift rather than the Romanian deadlift, which we are trying to drill. Going into this next set, I told Drake to maintain stiff legs and focus on pushing his hips back rather than lowering them to the ground. These would be two more examples of attention cues. By removing the assistance of the wall for this movement, we are able to progress the skill and make it more complex and more effective. This would also be an example of drill design, as we have strategically placed the wall RDL before the paused RDL. Using a progressive skill approach, we are able to ensure safe learning, which is vital in post-injury settings. Alright, to conclude, I chose this practice approach because with constraints, we're able to place emphasis on the aspects that we're trying to with this post-rehab training, such as eccentric training, with that 3-second eccentric and the 1-second hold and the pause RDL. Using attention cues when there's errors, we're able to draw attention to those specific body parts since we are working with weight training, and that's a big part of maintaining perfect form when weight training. And for drill design, we're able to build off the drill before with the wall touch RDL moving to the pause RDL by focusing on that hip hinge first and then removing the wall aspect, which really is able to help utilize progressive skills through drill design. And that is all I got, so thank you guys for watching, and I hope you all have a great day.